back to Cup of Joe. I'm joined this week by our Chief of Staff, Ashley Bellew, and she's going to be helping facilitate a conversation about a big topic that we're talking about these days in Congress, the enhanced tax credits for health insurance subsidies. Thank you very much for joining me, Ashley.
Thanks for having me.
Hello. I want to kind of start off by setting the stage that enhanced tax credits is a complex sort of concept, but really when you boil it all down, it's about a subsidy that the federal government is providing to folks to support their purchase of a health insurance product on the Affordable Care Act marketplace for insurance plans. And we're going to talk a lot more detail about all these, the way this all works, but I want to focus on it's a subsidy. It simply uses the tax system as a vehicle to get that money to subsidize your insurance premium.
So I know that there's been a lot of talk in the media recently about these tax credits, and I'm really confused, and I was hoping that you could provide some clarification for us. And so, from my knowledge or from what I know, it seems like these insurance companies are making millions, if not billions of dollars each year, and now they're getting subsidies on top of it. So why would we continue to subsidize the insurance company as opposed to the individual?
Ashley, I could probably take an hour going through this, trying to unpack it all. But first of all, the enhanced tax subsidies or enhanced tax credits is what they're called, are to the benefit of the taxpayer.
Okay.
And then the taxpayer is given the option of using those tax credits to reduce their monthly health insurance spend if they're buying a silver plan on the ACA, Affordable Care Act marketplace.
Okay.
So coming out of the Affordable Care Act was the establishment of these marketplaces where anybody could buy an insurance. So it used to be in the day before ACA, if you wanted to buy an insurance policy, you'd had to go directly to Blue Cross or United or what have you and go through the whole application process with any of those companies before you could find a price. And they would price it based upon your own medical history.
Okay.
So as you can well imagine, there's no pool, there's no spreading risks around because it's your risk that they're evaluating, and it was phenomenally expensive. And very few people could afford a policy purchased directly from an insurance company. So they established these marketplaces where you can go shop them, and they got all of so you can go look at Blue Cross's silver plan in Houston and United silver plan and Aetna silver plan, and they all have their benefits listed out and their costs. So you now have a marketplace, and instead of them pricing it based upon you, they're pricing it based on the pool of people that they're covering.
Okay.
Okay, does that make sense? So they're spreading the risk over a pool of thousands of people. And that therefore, one person's healthy, one person's not healthy, it balances the risk out and you have a lower priced insurance plan that comes out of that. Now, the trouble with that is it's still ridiculously expensive to get health insurance. You don't see it when you're an employee because the employer has to cover, I want to say 80+% and maybe 90% of the cost of the health insurance. Under the Affordable Care Act, as an employer, we have to cover most of the cost. So you don't see it. But when you go out into it as an individual, then you see the whole cost.
So how much would the average family of four spend on health insurance every month?
The projections that I've read is between $1,000 and $2,000 a month for a family of four.
Wow.
So if we just pick the average, $1,500 a month for a family of four, which sounds maybe reasonable to some people, but if you're making $60,000, $80,000, $100,000 a year as a family, taking, what is it effectively, $1,500, that's $18,000 a year out of your income, doesn't leave a whole lot for a roof over your head, a car to drive, insurance to cover your car, food.
Yeah.
Kind of food's important. Yeah,
Right.
yeah, it's
Right.
it's phenomenally expensive. And so the enhanced tax credits came about in 2020, and then when were renewed in 2021, I believe. I think I might have my years off a little bit. But what they did, this is during COVID, and what was happening during COVID is everybody was getting sick. Everybody was getting sick. And a lot of people were getting very seriously ill and showing up without any health insurance, basically putting them into bankruptcy through no fault of their own. I mean, COVID was a worldwide pandemic and people were getting it. They couldn't stop getting it because we just didn't have the technology to prevent it. And so they were getting sick and they were becoming bankrupt due to their medical debt. And the government decided, well, we need to do something to prevent that. And so they enacted these enhanced tax credits to reduce the cost of the health insurance down to an affordable level. And so what we're talking about is instead of spending $1,500 on a policy for a family of four, you might be spending $250 or $500 or sometimes even less dependent upon your income. Because the lower your income, the more the subsidy is. The higher your income, the lower the subsidy.
That makes sense.
Okay. And then they put in a rule that said you should never have to spend more than 8.5% of your adjusted gross income. Don't ask me what adjusted gross income is. That's a tax question. I'm not a tax person. But no more than 8.5% of your adjusted gross income should be spent on your health insurance. So now, where does this notion come from that we're subsidizing these insurance companies? Well, the fear is that with the government funding the subsidy and not having a cap on the subsidy, that the insurance company can just increase rates. And in doing so, they make more of a profit.
That makes sense.
It makes sense. I think there are rules, however, I'm pretty sure there are rules, again, within the ACA that stop a insurance company from making too much money. In other words, out of the money they collect from you for the insurance policy, they have to spend a certain amount of money, a certain amount of that on your care, and then they have a certain amount that they can use for overhead and a certain amount left over for profit. So if they get too high in their insurance policies, they're going to have to end up giving refunds, I guess. I don't know what the mechanism is, but they can't. They're precluded from law from spending your money on producing profits for them in an excessive sort of way.
So how would the average consumer know if they're eligible? Like who would be eligible for one of these subsidies?
Well, anybody is eligible for the subsidy, and depending upon your income, changes the subsidy. But I don't know if there's a cap on it. The 8.5% cap is the issue. So if you made $500,000 a year, you wouldn't be eligible because the 8.5% of your income is going to well exceed the cost of a silver plan. Now, by the way, this enhanced tax credits applies only to silver or lower plans. So on the ACA marketplace, you have silver plans and you have bronze plans, which is the lowest. When I say the lowest, it's the lowest cost and the lowest benefits. Then you have silver plans, which is the benchmark. And then you have gold plans, and you may have other plans that I'm not familiar with, but these enhanced tax credits can only be used to purchase a silver plan.
A silver plan. Okay.
Right.
Okay.
So if the silver plan costs $1,500 a month, $18,000 a year, clearly if you're making $500,000, you're not going to be eligible. So what's the number? If it's 18,000 and say it's 200,000, it probably goes out somewhere between 150 and 200 is your eligibility goes away for any of these enhanced tax credits. Now, of course, it's declining as your income increases, the subsidy decreases accordingly. As your income increases, the subsidy decreases.
That makes sense. Okay. So how is the federal poverty level, I guess, how is that calculated?
Okay, so this is delving into the mechanics of the federal government. I can't speak to directly, but the 100% of federal poverty is the line in the sand where the federal government says if you are below that level, you are not making enough money to support yourself in even the most basic way. You can't feed yourself, you can't clothe yourself, you can't put a roof over your head.
Sure.
You don't make enough money. And in the United States, the 100% of federal poverty for a family of four, believe it or not, family of four is something $28,000 and change, which is kind of crazy.
Yes.
$28,000 and change for a family of four. I don't know how anybody lives on that, but that is the definition of the federal poverty, 100% federal poverty.
So if you're at 100%, you are fully subsidized. Is that correct?
To the best of my knowledge, yes.
Okay. So if you're somewhere between 200 and 400%,
subsidies go down.
Subsidy. So if I'm over, say, 400%, then I don't get a subsidy anymore.
You might still get a subsidy. Remember, it's 8.5%. So let's use in Texas, let's just take the assumption that we're $1,500 for a family of four. And again, 8.5% on $200,000 is what's it, a little over, it's probably $18,000. So it looks like $200,000 would be your cutoff.
Okay.
Now that's well above 400% of federal poverty. So 400% of federal poverty, I want to say, is in the $130,000 range for the family income. So you're still getting subsidies, and this is why it's so interesting what's going on. There are a lot of folks that are solo entrepreneurs. Maybe they drive an Uber or what have you, and they make too much money to be eligible for Medicaid or something like that, but they don't make enough money to buy their own health insurance at an affordable level. And so a lot of these folks went without health insurance before these enhanced tax credits came to be.
So how, for those that choose to not get health benefits, what is the effect of that long term? For them and for taxpayers?
There's a lot of people who think it doesn't matter if I have health insurance, I'll just go into an emergency department. And every emergency department in the United States is required to treat regardless of ability to pay. However, what people don't know is that emergency departments are only required to treat the emergent situation.
Okay.
So you come in and you're spitting up blood and we give you a chest x-ray and we do other diagnostic tests and we determine that you have lung cancer. Well, once we've made that determination, that does not immediately threaten your life or your limbs.
Okay.
And so we discharge you and we leave you to figure out how you're going to get treatment for that. And therein lies a big, giant problem, because if you don't have a county-funded health network, healthcare network, you're like in Fort Bend County, we don't have a county-funded health network, then you're kind of stuck having to pay for it yourself. And cancer treatment can run hundreds of thousands of dollars per year.
Wow.
And it's not within the capacity, and it's really a terrible situation. In the United States, folks without health insurance generally live on average 20 years less than people with health insurance, because they don't have access to higher cost specialized care, because they don't have access to primary care that would have diagnosed that persistent cough as cancer early enough that it could be treated much less expensively.
So then I bet that a lot of those become permanently disabled faster or earlier too.
Yeah.
Even with a shorter life expectancy.
Right. Okay. So I have a background, undergraduate background in economics, and I try and tell people, I said, there's a hidden cost to the uninsured, to the taxpayer.
Sure.
So I'm an otherwise healthy working soul. I smoke. Yes, fine. I smoke, and I get cancer, lung cancer. Now, as a working soul, I'm paying income taxes. I'm paying property taxes. I'm paying sales taxes. And I'm not taking governmental subsidies other than these enhanced tax credits to the extent they exist.
Sure.
So now I get lung cancer and I become permanently disabled. Now I go from being a taxpayer
Mhm.
to a tax recipient above and beyond these tax credits. I can't afford my home any longer, so I have to move out of it. Those property taxes are lost.
Mhm.
My income has dropped by half to three quarters, assuming I have a spouse that has some level of income, and that all that taxable purchasing
Mhm.
goes away too.
Yeah.
And there's thousands of dollars. If a
Sure.
person's making $60,000 a year, let's just assume that $60,000 is spent exclusively on goods and services in the community,
Mhm.
clothing, what have you. And 8% of that spending is a tax.
Sure.
It's $4,800. So
Sure.
it's really crazy how
Mhm.
people how much a lack of insurance can cost a community.
So you mentioned earlier that if you come into the hospital and you don't have health insurance, we have to treat you, but as long as you aren't, how did you phrase it? As long
As long as there's not a risk of life and
for
limb, we can discharge you
Sure.
to seek care further.
So how would that work in the case? I know we had a patient earlier this year with malaria, and she did not have resources. So, and we treated her. How was that? How are we able to do that?
Well, she was in a coma, which
Okay.
that's pretty much a threat to life.
Sure. Sure.
So as long as she was unstable and in that sort of situation, then we were obligated under the law to treat her to the best of our ability to treat her. Now, we don't do certain procedures. We don't do transplants. So
Sure.
if you come in here and you need a heart transplant, if we can't get you transferred to another facility that does heart transplants, that's a terrible situation.
So, okay. So it's starting to make more sense. So these tax credits are going away at the end of the year. So
Enhanced tax credits.
enhanced tax credits.
Right.
They're a difference.
Yes, because
Okay.
in Obamacare, the original law that was put into was enacted in 2010, there were subsidies for the poor in that. The enhanced tax credits added more subsidies on top of that.
Okay. Okay.
So the real beneficiaries, I shouldn't say the real beneficiaries, the ones that are getting benefit out of the enhanced tax credits are not the people that are sitting at the lowest level of income, like below 100%, because they may have already been subsidized under the ACA. It's people at 200 and 300 and 400% of federal poverty that were getting no subsidies under the original act that are getting subsidies now.
That makes sense. Okay, that makes sense.
So there were 11 to 12 million people insured through the marketplace before the enhanced tax, U.S.-wide. 11 to 12 million people that were insured through the marketplace pre the enhanced tax credits.
Okay.
We now have 22 to 24 million insured through the enhanced, through the marketplace. And states that didn't expand Medicaid are the ones that are really benefiting from the enhanced tax credits, because in Texas, which did not expand Medicaid, it doesn't matter how poor you are, you're not eligible for Medicaid if you are between the ages of 21 and 65 and you're not disabled.
Okay.
The only way you get benefits under Medicaid in Texas is if you're poor, under 100%, and you're pregnant. That's it.
Okay. So what happens if your taxes are less than the value of these credits?
Then you get your taxes are less than the value of the credits, and the government kicks in to subsidize the insurance so that it doesn't exceed 8.5% of your adjusted gross income, AGI.
So you potentially are going to get a refund for...
No, not a refund. So you said taxes are less than the cost, right? So they're going to cover the difference. The federal government is going to cover what you would have been taxed and what the cost of the insurance is.
Okay.
Now, you don't have to take the tax credit up front. You can pay the full cost of the insurance and then put the tax credit on your refund, on your tax return.
Yourself. Okay.
And then you get a refund, the next year. Nobody does that because
Sure.
why would I wait till next year to get my tax credit when I
Sure.
can get it up front?
That makes sense.
Yeah.
Okay, so we know how this is going to affect us in Texas since Texas didn't expand. How is this going to affect us here at OakBend?
Well, if you take half of the population that is receiving benefits through these silver marketplace plans, and you jack up the cost of the insurance by 50, 100, 200%, which it can go up that much,
Sure.
then you have to expect a certain percentage of them to drop their insurance.
Wow.
So they're going to come in, and so today, we have about 20% of the population we serve in the emergency department is uninsured.
Wow.
Before the Affordable Care Act was passed in 2010, almost 30% of our ER population was uninsured. So somewhere between 20 and 30%. So we're going to rise from 20% uninsured to somewhere between that and 30%, which is where we were before ACA.
And how quickly should we start seeing these changes?
We'll see it January 1 because, whomever can't afford it is going to drop their policy as soon as they know that the policy is unaffordable.
Wow. Well, I think you helped clarify a lot for me. It's.
Well, let me add one more thing. There's a conversation today going on about funding people's health savings account with some money for them to use to spend on insurance.
Okay.
And the problem with this is that unless you have an illness, a chronic illness that is going to require continued medical care, the average person doesn't want to spend their money on insurance. The insurance is protecting you against something that might happen. Well, if you're reasonably healthy, the might happen, here's the might happen over here, here's the money over here. Well, what am I going to do? Am I going to spend my money on the might happen, or am I going to wait until the might happen happens and then spend my money? And what happens in the course of time is you're uninsured.
Sure.
So guess what? You don't go to your doctor because you don't have insurance. So the might happen is more likely to happen
Right.
because you don't have insurance. We talk about making the consumer responsible for the costs of the care that the consumer receives. But the truth of the matter is, even though you and I are both in the healthcare world, we're not physicians.
Right.
And we're not even necessarily physicians in the particular specialty that we need to be in to know how we should be spending our money. We're just like, okay, well, I don't have anything, therefore I won't spend it.
Okay.
That's just what even people inside the healthcare industry are going to think, and that's where the problem is going to arise. And there's a lot of evidence that when we increase the cost to the consumer drops their consumption. Duh.
Yeah.
Price goes up, consumption goes down.
Sure.
Well, that applies to healthcare, just like it applies to, if the cost of eggs goes up, you eat fewer eggs.
Sure. Sure.
I mean, it's supply and demand. It's a rule that doesn't change just because the service is a necessary service. It's just like, okay, I can't afford it, I'll use less of it. And so we're getting this money in our health savings account, but we don't recognize the importance of preventative care because we're otherwise healthy. So we don't spend it on insurance. We therefore don't go get preventative care. Because I know, as an example of this, I know of somebody that wanted to go see a cardiologist who was not in network.
Okay.
And so if they're in network, what's your copay? $40, generally speaking.
Right.
Okay, so this cardiologist told this person, well, if you want to come see me without any insurance, it's $250.
Wow.
Okay, well, how many people are going to write a check for $250 for a checkup that may or may not be necessary? Now, this is a cardiologist. This is a heart issue.
Right.
Okay, that's kind of necessary.
Sure.
But again, $250 to somebody making $60,000, $80,000, $100,000 is a lot of money to be spending to see if there's a problem.
Sure.
It's not known that there's a problem. It's like maybe. And so that untreated heart condition
Mhm.
goes on and on until what happens? Heart attack.
Sure.
Now you've got a much bigger problem,
Sure.
and it's too late.
Sure.
You've foregone the preventative care, the medications that may have addressed the underlying issue which
Mhm.
that was causing the heart problem to begin with.
Wow.
Yeah, it's
It's
crazy.
a vicious cycle.
It's supply and demand.
Mhm.
I'm not going to pay for something. The more expensive it becomes, the less I'm going to use of it.
Sure. Interesting.
Yeah. There are a
Wow.
lot of things that are little known about our insurance market that
Right.
get a lot of press, and sometimes without all the facts there.
Right. Well, I appreciate you providing the facts from everything that we hear, on social media
I
and
do
TV
my
and
best.
all that. So thanks. I mean, for me, you've cleared up a lot of what's going on.
Cool.
Thank
Well,
you.
thank you very much for joining us today, and I look forward to seeing you or talking to you on another Cup of Joe. Have a great day.